Hello, my name is Taylor McCabe, and I decided to do my presentation on Clostridium difficile, also known as C. diff. I decided to pick this topic due to currently working in a healthcare facility and seeing this infection in a magnitude of patients wanting to get a better understanding on the causes and preventions for this particular infection. What is Clostridium difficile exactly? It is a bacterium that can cause symptoms ranging from diarrhea to life-threatening inflammation of the colon. C. difficile bacteria are found through the environment, in soil, air, water, human and animal feces, and food products such as processed meats. A small number of healthy people naturally carry the bacteria in their large intestines and do not have ill effects from the infection. Many may wonder how C. difficile bacteria is spread. Spores from C. difficile bacteria are passed in feces and spread to food, surfaces, and objects when people who are infected don't wash their hands thoroughly. In a healthcare setting, if proper hand hygiene is not performed after taking care of a patient with C. difficile, the risk for spreading this infection throughout the healthcare facility increases dramatically. Spores can persist in a room for weeks or months. If you touch a surface contaminated with C. difficile spores, you may then unknowingly swallow the bacteria. In many cases in a healthcare facility, after treating a patient with C. difficile, the room will be externally cleaned in order to prevent any further contamination of any other people within the healthcare facility. There are many risk factors when speaking in regards to C. diff. A patient that has been taking antibiotics, being 65 or older, causes a patient to be 10 times greater to acquire C. diff compared with younger people. Within a month of diagnosis, 1 in 11 people over ages 65 died of healthcare-associated C. diff infection. Serious illness such as inflammatory bowel disease, colorectal cancer, or a weakened immune system related to a medical condition or treatment such as chemotherapy causes a patient to be more susceptible to a C. difficile infection. Abdominal surgery or gastrointestinal procedure is also a very big risk factor for acquiring C. difficile. Estimated to cause 500,000 illnesses in the United States each year. Previous infection with C. difficile or known exposure to the germs. About 1 in 6 people who get C. diff will get it again in the subsequent 2 to 8 weeks. However, women are more likely than men to have C. difficile infection. In healthcare facilities, the majority of C. difficile infections occur in people who are or who have recently been in a healthcare setting, including hospitals, nursing homes, and long care facilities, where germs are spread easily, antibiotics are used commonly, and people are especially vulnerable to infection. In hospitals and nursing homes, C. difficile spreads mainly on hands from person to person, but also on cart handles, bed rails, bedside tables, toilets, sinks, stethoscopes, thermometers, and even telephone and remote controls. There are many symptoms of C. diff. Symptoms might develop within a few days after you begin taking antibiotics, but usually develop within 5 to 10 days after starting a course of antibiotics. However, it could become present after the first day or up to 2 months later. Once established, C. difficile can produce toxins that attack the lining of the intestines. These toxins destroy cells, produce patches known as plaques of inflammatory cells, and decaying cellular debris inside the colon and cause watery diarrhea. Diarrhea, including loose, watery stools or frequent bowel movements for several days. In severe cases of C. diff, it can cause dehydration, which is due to severe loss of fluids and electrolytes, making it difficult for your body to function normally and can cause blood pressure to drop to dangerously low levels. Dehydration can occur so quickly that kidney function rapidly deteriorates, resulting in kidney failure. Also, rapid heart rate, blood or pus in stool, weight loss, swollen abdominal, fever, stomach tenderness, loss of appetite, nausea, increased white blood cell count, severe intestinal inflammation, enlargement of the colon, also known as toxic megacolon, due to your colon being unable to expel gas and stool, causing it to become greatly distended. When this is left untreated, your colon may rupture, causing bacteria from the colon to enter the abdominal cavity. If your colon becomes ruptured, emergency surgery is required that may also be fatal. A bowel perforation, which is a hole in your large intestines, is also possible. This results from extensive damage to the lining of your large intestines or after toxic megacolon. A perforated bowel can spill bacteria from the intestines into your abdominal cavity, leading to life-threatening infection, also known as peritonitis. Sepsis is also a symptom and risk factor of C. diff. Death, even in mild to moderate C. difficile infections, can quickly progress to fatal disease if not treated properly. Many people wonder when to seek medical attention. 3 or more watery stools a day, symptoms lasting more than 2 days, a new fever, severe abdominal pain or cramping, as well as blood in stool. There are many diagnoses used when inquiring on whether a patient is infected with C. difficile. Stool tests. Toxins produced by C. difficile bacteria can usually be detected in a sample of stool. Polymerase chain reaction, also known as PCR, is a sensitive molecular test that can rapidly detect the C. difficile toxin B gene in a stool sample and is highly accurate. GDH/EIA. GDH is a very sensitive assay and can accurately rule out the presence of C. difficile in stool samples. Enzyme immunoassay, faster than other tests, but isn't sensitive enough to detect many infections and has a higher rate of falsely normal results, typically not the test used. Cell cytotoxicity assay test looks for the effects of C. difficile toxin on human cells grown in a culture. This type of test is sensitive, but is less widely available and requires 24 to 48 hours for results. Colon examination, in rare cases, helps confirm a diagnosis as well as look for alternative causes of symptoms. Imaging tests used to detect the presence of complications caused by C. difficile. There are many treatment options when treating C. difficile. The first step in treating C. difficile is to stop taking the antibiotic that triggered the infection. Once the antibiotic that triggered the infection is stopped, a different antibiotic that keeps C. difficile from growing, which treats diarrhea and other complications, would be the next approach. Surgery is used for people who have severe pain, organ failure, toxic megacolon, or inflammation of the lining of the abdominal wall. Surgery is used to remove the disease portion of the colon. Antibiotic therapy for reoccurrence may involve in 1 or more courses of a medication. Guidelines recommend not repeating the same therapy used for an initial infection when treating a reoccurrent one. Fecal microbiota transplant, also known as a stool transplant, is emerging as an alternative strategy for treating recurrent C. difficile infections. However, it is not yet approved by the FDA. FMT restores healthy intestinal bacteria by placing another person's, which would be a donor's, stool in your colon through a colonoscope or nasogastric tube. Probiotics are organisms such as bacteria and yeast and are available over the counter. The role of these products in C. difficile infection is controversial. There are many ways to prevent C. difficile from spreading and acquiring. Hospitals and other healthcare facilities follow strict infection control guidelines, avoiding unnecessary use of antibiotics. Antibiotics are sometimes prescribed for viral illnesses that aren't helped by these drugs. If you need an antibiotic, ask your healthcare provider to prescribe one that has a narrow range and that can take for the shortest time possible. Practicing good hand hygiene using soap and water, not hand sanitizer, as they do not effectively destroy C. difficile spores. People who are hospitalized with C. difficile have a private room or share with someone who has the same illness. Hospital staff will wear gloves as well as isolation gowns to prevent spreading the infection. Thorough cleaning is also a very important approach in the prevention of C. difficile infection. I hope you enjoyed my presentation on C. difficile infections and learned a little bit more about the prevention and causes of this infection, as well as ways to prevent it from spreading.